Good to see you, Shano. Well,
Good to
hey,
hear you, Kim.
good to hear you. Welcome back to Avenues of Wisdom. Okay, this is where we share things all light, love, and wisdom. And, I got some honorable loyalty here that have been sitting with me for the past 22 minutes trying to help me figure out how my mic works. So I wanted them to come on here. And basically, we've been together for 11 weeks. And I guess Shano said it feels like one eternity later. But I think it's been a little bit more than that. So I want to introduce the PT students and the OT students who I've been with. And Annie, you can start off, love.
Hello, I'm Annie. I am a fellow OT student of Kim's. We are in the same program at St. Scholastica.
Hey, and Bales, love.
Hey, I'm Bailey O'Connell. I'm also in the same OT program as Kim and Annie.
And the PT students, huh? Who wants to start off? Who's the shining star? Shay's the shining star. Start off, introduce yourself, honey.
The technology star tonight, I guess. But I'm Shay,
Yeah.
and I am a PT student at Mayo Clinic. And I've got the privilege of working with these 3 OT students in the last 11 weeks.
Hey, beautiful. Sean or Austin, take it.
I'll follow up after Shay. My name is Austin Culla. I'm also a physical therapy student at Mayo Clinic, doing my rotations now with these other 5 wonderful people. We're currently on our acute care rotation. So
We sure are. Sean?
Yeah, and I'm Sean. I'm also a student for Mayo Clinic with the Austin and Shay.
Pleasure. So, I wanted to bring these guys on because honestly, we've been back to back for 11 weeks, and by back to back, I mean in a cubicle space, 10 by 20. I don't know. You could probably measure the meters better than I could. So, what has been most enjoyable about this process so far, knowing that Annie, Bailey, and I as OT students, and y'all as PT students, we hadn't even met each other yet.
I can start, Kimberly. It's been
you.
very enjoyable. I know I can speak on the behalf of Shay and Sean. We actually had the halfway mark of our clinical rotation, our clinical instructor asked us where we wanted to be based. So we have 2 spots. At the time we were on the ortho floor, so we could have either been based on ortho, but we pleaded with our clinical instructor, Mo, to be seated next to the OT students just because of their great personalities, but also just because PT and OT, they work so well together. And it just makes things easier being with the OT students. I mean, if we have issues about discharge or what OT's thinking, we just turn around right next to them and talk to them about the person, and they're always ready to share. So it makes it enjoyable. It's nice talking to people in person and not over the phone or over email about patients. So you can kind of get those little quirks out. Just makes it more human.
Yeah, thank you for sharing that. What do you think, Shay?
Yeah, I mean, I'll second everything Austin said, and I will also add that sharing patients with you guys was so special, especially when we were like in ortho together, and just getting to discuss like the best plan of care for those patients and seeing your perspective of it, especially from a cognitive side, is really eye-opening for me, because I think sometimes we get so caught up in the physical aspect of things and what they can physically do, but getting to hear OT's opinion on somebody's cognition was like really insightful.
I didn't think, and I maybe, and you're Bailey, like, it's funny that we knew we were part of like the cognitive piece, but then like when y'all would like say, oh yeah, like thanks for your input, it was just so nice to see that when we were like co-treating together, you guys saw that as well. Did you like feel that too, Annie and Bailey?
For sure. I feel like there's so much overlap with OT and PT, right? And so then when we can point out like, hey, actually, you know a lot about that, I'm so glad you do because I don't, and then like vice versa, it makes it a lot more enjoyable when you realize what you don't know.
Yeah, I think it's been just super beneficial to like meet and collaborate, when we are co-treating. Like maybe OT pops in a few minutes before, PT stays a little bit after, just to get the separate disciplines where we don't overlap as much. But it's just all about, you know, being efficient for the patients and kind of seeing them in a more holistic view, and being right next to each other makes it just infinitely easier with planning and coordinating and talking after, like, hey, I saw them before you walked in and I saw this, and like, what did you see after I left? You know, patients can change so much even within the hour, so it's just been a really great experience.
But what input on like the co-treatment with like all of us?
It certainly takes a little bit more effort planning before you go into the session together, but I think the benefits are triple fold. Like once you're in the session with having two different minds on the same patient coming from two different perspectives, I think not only does it increase like efficiency with the patient, so you're not bothering them multiple times throughout the day, but like just safety for the patient too, because you've caught things, even just little things, I don't even know, but just, oh, that was a great catch, Kim, or yeah, thank you for that, or you're able to hold the patient while I can go grab something, or you go out in the hall and grab some other piece of equipment for them that they might need while I can tend to the patient. I think just for safety and efficiency overall, and to get the whole picture, it just, the benefits are triple to threefold. It's just, yeah, it's really wonderful.
Yeah, especially when like they benefit from like two or more hands up in there too, which has happened quite a bit, especially now with us on Francis, but you guys are in other parts of the building as well. What Austin has your day been like? I feel like since we've all been in field work, or if someone's watching and they haven't done field work or rotations yet as like a PT OT student, what's your advice to them, Austin, for like, I mean, we're busy all day and then we go home at night and we just want to rest. So what's your advice to them regarding like their management of their time and their routine?
I think the best things in the acute care setting, at least here at Mayo, no one's looking over your shoulder to make sure you're seeing your patients. No one's looking over your shoulder to make sure you're checking all the boxes so you can get them the equipment from a PT perspective, you know, check mobility, get equipment they need, and even make discharge recommendations to help service or the docs make a discharge recommendation. So I think the first thing is just prioritize your day before you even hit the floor. I think in other settings, like in ortho, you have that schedule so you know what's going to happen at every minute of the day. Acute care, you really gotta make a schedule that can be changed, because you never know when the patients are going to be kind of at procedure, or maybe they're not feeling well, or maybe they're agitated, their cognition, they're not allowed to kind of work through sessions with you. So the biggest thing is make your initial plan. And then we have an acute care professor who says even make a plan all the way to plan Z, and just be able to roll with the punches. The way I learned to kind of set up my day, and it's pretty similar to Shay's and Sean's, is we do our chart review in the morning. We absolutely know everything about our patient before hitting the floor, so we're not getting mixed up and we don't have to run around and, quite frankly, look like idiots in front of other providers. But once we know everything about them, we pretty much hit the floor and we just bounce between rooms to see who's ready to be seen, who's up, who's had breakfast, who's had meds, who's stable this morning, who's not at procedure. And then usually we get done at about, I would say 1 or 2 o'clock with treating patients. And then that's kind of like my mental break where I know I've seen everyone. I know I've checked all the boxes on the medical floors. And then I just start doing notes or contacting service about what I've seen throughout the day. So it's just kind of finding what is best for you. I know Shay can probably speak to kind of her experience. She's really efficient. I mean, she uses her time very effectively, where if she's not seeing a patient, we have the luxury of having computers in the hallways at Mayo where she's, you know, documenting. So it just kind of, I relatively ask myself throughout the day, okay, I wasn't able to see this patient, but what can I do in this moment to be productive or make a difference or update someone on a status or get my notes done? So it's kind of rough, but you just go with the flow.
Yeah. Shay, you want to touch on that or elaborate on that, love?
Yeah, I think Austin made a great point saying like find what works for you. I know that like Sean gives himself 30 minutes at lunch every day, no matter what. During his lunch hour, that's his 30-minute kind of break. I am like a go, go, go person. So I work through lunch. I'll eat and I'll document while I do lunch. And I hit the floor as soon as I can in the afternoon. I document in between patients in the hallway. And I'm usually done with my day at like 2:30. And I'm just like ready for my notes to get signed by my clinical instructor. I'm good to go. I can study for boards a little bit in the afternoon at my desk, waiting for her to sign those, but I'm done. And that's like me time at the very end. Whereas the boys kind of spread out their breaks throughout the day a little bit more. So I think it depends on what works for you. I do like that Austin said, finding a way to be efficient. So a lot of the times we're waiting for our CI because the CI has to check in on us like every other visit with a patient. So if I know that I need my CI, I make sure that I have the wheelchair, I have the extra blanket, I have the things I could be doing after I've already paged her that I'm outside of that room. So I'm kind of doing these little tasks that take up time and getting that prepared while she's on her way.
Yeah, and Sean, you go about your day a little bit differently too, like Shay said.
Yeah, I'm a little slower. Take things a little slow. But yeah, I don't know. I think I need to adapt Shay's techniques of paging her first before even stepping in the room. Because what I end up catching myself doing is just having a conversation with the patient and which, it's not bad at all. Like, for example, I probably had a 10-minute conversation with an individual as discharging, him and his wife, and, talking about my future clinicals and talking about where they live, what are their plans for this upcoming. So,
Yeah.
which I think is beneficial for the patient's sake too, just to have time with the provider, ask questions, because there were medical questions that popped up through that they thought of or had forgotten to ask. But it definitely hurts my efficiency a little bit. But I really enjoy like actually just talking to the patients. And if I didn't have to document, man, I'd be in every patient's room for probably an hour or more, which would be good. But
LOL. Yeah, most of us are like chatting and then we have to like balance that. But like Shay knows for sure, like I'm in, I'm doing my thing the best that I can. But then she's always like aware of her time, which is cool. You touched on the paging of your educator, your CI. Annie and Bailey kind of speak on. We're gonna go into like everyone's input on like the 3-to-1 model, because we're all on a 3-to-1 model. Some other rotations or fieldwork have like a 1-to-1 where it's their educator and then it's just one student, but there's 3 students basically to one educator or instructor. So Annie, Bailey, kind of elaborate on your thoughts on that.
I have personally loved the 3-to-1 model. I think it's been amazing for learning purposes, especially if you have a challenging patient. You come back and you're like, not only venting, like, I just went through this experience, I just learned so much, it was so uncomfortable or whatever, As a student, a lot of stuff is, a growing experience, and you feel like you need to share that in a safe way with fellow students is a great way to do it. And also, it just provides so much learning, like, oh, this happened and I wasn't prepared, and so I learned that we should do this when the person is dealing with X, Y, or Z. So it's just a great way to kind of share experiences, learn from each other's mistakes or successes. Like, guys, I had this great session and I did this and I tried this and it was awesome. Like, I would recommend it. Those types of things are just so easy. We're sitting right next to each other. And I think we've done a good job of kind of gauging when we have time to talk and chat about it versus like when we need to get stuff done. So I've loved the 3-to-1 model, and I think it definitely helps that we're in the same program and comfortable with each other. So
I love that. Bailey, you have any elaboration on Annie's input?
No, I totally agree. I feel like at my last placement, I was the only student and there was like 50 therapists there, so I felt super isolated, like I was the only dummy in the room usually. So it's really nice having other dummies in the room. Other people though to like share, like, oh, I didn't know that either, like, you know, maybe you shouldn't expect yourself to know everything, and somebody else sharing that experience with you is really nice. And then it's also nice to be able to, like, I don't know, like, I feel like with people that aren't students, sometimes you feel like you always have to be really professional with them, which of course you want to be professional at work, but every once in a while you need to, like, make a joke. And so sometimes I can throw things at Austin and it feels really good.
LOL. He's right behind you. He sits right behind you.
Especially at the very beginning of this clinical, because I would treat a patient and the boys would just kind of be there, and then Austin would treat a patient and me and Sean would kind of just be there and go get a gait belt or something. And it was kind of nice, like, hey, good job, you did great on that, whatever. And learning from watching them work with patients was really nice too. But I will say the efficiency side from my type A personality is like a little too slow for me.
Yeah, I kind of elaborating off of you. I feel like maybe it's a little different from like our experience, but I can feel you when it's like you have 5 patients you want to go see and you page your instructor, but they just have to be with another student as well at the same time. Like, how do you, that's kind of, it's not the instructor, it's like the system that sets that up and says, here's the 3-to-1 model, we're going to give you more students, you know, and one instructor is going to just be able to handle it because, you know, they can. But at the end of the day, like, we're the ones experiencing that too. And it's not always efficient. So there's pros and cons, like you said. What do you think, Sean, as well?
Yeah, it's really not an instructor's problem. It's definitely the system's problem. I think, like, ideally, it would be a 2-to-1 model. Like, that's probably where you could maximize efficiency and education and supervision. I feel like that'd probably be, I don't know, I feel like that might, if you're looking for an efficiency standpoint, it'd probably be a 2-to-1. I just feel like, but really a 3-to-1, yeah, it works. It works fairly well most of the time. There's just those glitches in the system still where, I don't know, it seems like everyone else said, you're stuck, you're waiting, you're on an island, you're like, well, I don't know what to do, I'm trapped in this patient's room. But yeah, really, kind of on what she was saying, yeah, this is a very good group. I had my last clinical rotation, there was another student from a different school, from St. Kate. So right away, I was already like, ooh, you know, them versus us, or me versus them. So that was kind of almost a competitive at first approach. And she was definitely a competitive spirit. So that kind of didn't make it very, very good. So, but it worked out in the end. But this has just been a smoother transition throughout, especially when you have 2 other colleagues who you've gone to school with. You've already spent 2 years in the classroom with them. So
for me to be able to, like, reflect and slow down would be like my number 1 advice for students, if they can just take time each day and write what they've experienced, who they met, what they've learned, what's been meaningful to them, and actually, like, document that and have meaning in that. That's my number 1 advice, because I definitely skipped a few days because I've moved so fast at fieldwork, and I've come home and I've just been exhausted, to be honest. So, Annie, what is your advice for people on the end of their journey, or other students as well?
Yeah, I think that Bailey, Kim, and I really sort of burnt ourselves out a little bit at the beginning of this field work, because it is super fast paced, and we just felt the need to be go all the time. We were working through lunch a lot of the times. I mean, we got lunch like the first week, and then we were like, remember the good old days. And then during week 10, it really just kind of happened that we were encouraged to take a break, and it was like pointed out, like, you guys are really burnt out, I think. And so we took the time to just, like, chat over lunch and just regroup, and it was funny how it made us more efficient at the end of the day. Our brains worked a lot better. We were happier. We were just treating better. And so I would say just like prioritize that break throughout the day, however long you can afford to do it. It's really important. And although it might not seem efficient, it will be efficient in the long run, and it'll kind of speak to the longevity that you're going to be able to do this for the full 12 weeks or however long your rotation is. And going into the future too, you know, this is going to be your career, and you need to be able to uphold that for as long as you can without being burnt out. So that's my advice.
Yeah, that is dynamite, love. I totally resonate with you on the burnt out piece. Didn't notice it until we were told to take like a break as well. Bailey, what are your thoughts?
My biggest one is also, what Annie was talking about. I also feel like I realized more lately that I was super focused on like what's this patient's mobility and what's their cognition, that I like forgot to like see them as a human for a bit. Like, wait, no, like tell me like how are you actually doing? Like, let's talk about our feelings a little bit, because like being in the hospital is such an emotional journey, and I don't know, like being able to acknowledge that like fulfills me and fulfills them a little bit more, I think. So I don't know, just like along the way, don't forget that people are humans, you know? I don't know.
Yeah, that's like what I said with you get there and you're just expected to move really fast, that you can like overlook like this is a person, not like just like a checklist in a way, which is like real, so real. Shay, what do you think, love, on your guys' perspective from like physical therapy perspective as well, on advice as well?
Yeah. I like what Bailey said about seeing people as people. I'm like an emotionally attached person to my patients. Kim witnessed that firsthand. I like every emotion they feel, I just like it attaches to me, and I cry with them, you know, I'm angry with them. And I think that can be really good and it can be bad. It can make you really have that emotional toll. But I will say that one of the professors told me before clinical rotations to love something about every patient. Like find something that you appreciate about every patient. I mean, you can have someone who's just super delirious and cognitively just not there and angry and agitated and maybe even a little bit violent, but like something you can love about them is like their drive that they want to get out of the hospital. Like that's how independent they are. They want to get out. And so just finding something that you love about each patient makes it a little better, even if it's not the setting you want to work in forever. Just know that there's something about that person to love and to like tap into.
Yeah, love something about each patient. I like that's just reframes you basically. That's awesome. Yeah. What do you think, Austin?
I think my big advice comes something that I can attribute that maybe others weren't talking about is just playing the student role. I can kind of walk you through like my first through second, now third clinical rotation. My first rotation, you know, I didn't embrace my student role. I was kind of the student that wanted to look the smartest. I wanted to show clinicians I was competent. I wanted to show that I could do things on my own and they didn't need to be there with me. And I wasn't arrogant. I wasn't ignorant. I mean, you know, you always want to accept your mistakes, but I think just playing the student role of clinical rotations, I know a lot of people try to use them as advances to obtain, you know, a job and to show that you're just this fantastic person, but ultimately you're really there to learn. You're there to make mistakes. I mean, I did not, my first clinical rotation, I did not want to make a mistake at all. And now I think that was it's very unrealistic. You know, you got to be authentic. You got to play your student role. And what I mean by playing your student role doesn't mean to demoralize yourself compared to other practitioners. It's more or less just understanding you're going to make mistakes and you're there to learn from those mistakes. And like you said, Kim, you're there to reflect and you're there to understand what went wrong. And I think apart from that, I really had a tough time being Mr. Professional at my first couple ones because I really wanted to represent Mayo well. And now on my third one, I feel like I'm actually more of a human being with my patients. I'm not robotic. I don't talk to them like they have a medical condition. I talk to them like they are a human. And I think that just makes physical therapy or, occupational therapy or just any therapies in general better. Like, people don't want to be talked to like they're a medical chart. They want to be talked to that you're the provider that's going to give them their life back. And that you're supportive. And sometimes, if you're just playing the professional role all the time, you're not able to really authentically connect with that patient's personality. Like Shay said, you're taking that little part of the patient and you're kind of latching onto that part, So some patients, I've really learned to be myself, and some patients I'm really funny with, other patients I'm empathetic with, other patients I'm very stern with. So just kind of don't get too wrapped up in trying to look the best and be the best, because you'll probably miss the point of what it actually takes to be a good practitioner.
All right. Okay, that was dope. But yeah, facts. Sean, I'm gonna have you build off of that.
All right. I thought we were ending with the claps. Like, all right, here we go. Owning up to the fact that you don't know everything, even if you are working as a professional PT license, just showing that is letting them know you're a human too, and you're not just the medical professional that walks in there, let's get this done so I can check this box and I'm out of here. It's opening up, hey, I'm not perfect. Let me know a little bit more about you. Let's work together. But yeah, one thing I always like to ask is, so it's let's say it's, Tuesday afternoon. So it's a Tuesday afternoon. What would you usually be doing if you weren't here? And they'll usually, I'd be watching Gunsmoke right now. And Gunsmoke. Have you ever, I don't know. Then you just start a conversation about that. So that kind of gets, I feel like it allows me to like maybe learn that one thing about the person that I love or that I enjoy. Or maybe it allows me to learn something that I would never thought I needed to know, like this type of knitting. I forget its name now, but she quizzed me on it. What?
Cross-stitching?
Not cross-stitching. It's like a specific, like Norwegian type of
crochet.
weave. What's that?
Crochet?
It's not crochet. I said crocheting. I said, are you crocheting? No, this isn't crocheting. This is, and then she went on the whole tangent now, and I can't remember. Some goofy name. I can't remember what it is. Dang it. But anyways, because the next day she quizzed me on it. She's like, what's the name of that knitting that I do? And I'm like, oh no. But anyhow, just ask about what the patient's into. What are their hobbies? What would they usually be doing on a day if they weren't here in the hospital? It allows you to learn a lot more about the patient, right? What is it here? Norwegian knitting. Striking. Yes, thank you, Lisa, my secretary. Strikking. Yeah, that's it. That was it. Striking.
Yeah. Yo, well, I didn't know that. I learned something new. Thank you for sharing.
There you go.
That was absolutely beautiful ending there. I love that, Sean. So I want to thank all y'all. It's getting a little late, but I want to thank every one of you guys for taking the time out of your day. And if anyone has any more questions, I'll put the information below. And you can email as far as if you're a PT student, OT student, or any type of therapy student looking for advice, because this video is basically made for you. So I wish everyone a good night and stay tuned for more.